गुड न्यूज टुडे, नई उम्मीद जगाने वाला हिंदी न्यूज चैनल।
What is the current status in Kerala with regard to the COVID numbers? The southernmost state has reported 26,701 fresh COVID cases on Sunday. 74 COVID-related deaths also have been reported in the last 24 hours. After the death, however, remember, of a 12-year-old boy due to the NIPAH virus, government has started contact tracing. It has identified 108 primary contacts, of which 20 are high-risk category and have been shifted to Kozhikode Medical College. State Health Minister Veena George has announced to enforce a lockdown within 3 kilometers of the house to mitigate the spread of the virus. Meanwhile, amid rising number of these COVID cases and Nipah-related reported fatalities in Kerala, Tamil Nadu, the neighbouring state, has stepped up measures to monitor people who arrive from Kerala in 9 bordering districts. Tamil Nadu's Minister for Medical and Family Welfare, Ma Subramanian, has said health officials will hold fever camps at the entry point in these border areas. All passengers will go through thermal scanning along with testing of their saturation levels. With the state that continues to embattle the deadly COVID virus, Chief Minister Pinarayi Vijayan in Kerala yesterday announced that state will continue with the COVID restrictions. Kerala earlier, remember, had imposed the night curfew and lockdown on Sunday owing to rising cases in Kerala.
केरला को लेकर हम लोग सभी लोग पूरा देश चिंतित है। जिस प्रकार से दोबारा कोरोना की वापसी हो रही है, वहाँ ये चिंता का विषय है और वहाँ की राज्य की सरकार को इस बात को गंभीरता से लेना चाहिए।
Kerala government has miserably failed to protect the interest of the people of Kerala. They have not taken any action to prevent the COVID pandemic. At the same time, the central government has given so much of assistance and the amount they have released, but the government is not taking care about to protect the interest of the people who are suffering from this COVID.
So what is this Nipah virus that has led to the death of a 12-year-old boy in Kerala? Let me now take you through the details. It's a zoonotic viral disease. It is very important because it's also infectious, transmitted from bats and pigs to human. And that is why it gets more dangerous. Contaminated food, if there is, helps in spreading of the infection of the Nipah virus. Infected person can then spread to others. Remember, this has been of discussion in the past as well. And in Kerala, now that the cases have been reported, teams from the central government have also been rushed. What precisely is the status and symptoms? Fever, headache, cough, if that is what you're feeling, disorientation, drowsiness, importantly, and this can turn fatal, brain infection, which is also referred to as the encephalitis. These are some of the symptoms possibly if someone is affected from the Nipah virus. What can you do? What are the precautions? Wash your hands before eating. Importantly, if there is contaminated food, it does not infect your body. Avoid consuming raw date palm or toddy. These are some of the consumable items. So anything raw needs to be avoided for now. Consume fruits only after they have been properly washed. Handle the bodies of Nipah dead with caution because it's still being assessed or what exactly is the reason. Even with regard to mortal remains, if there is someone who's died of Nipah virus, to take all precautions. Very similar to how we need to take all precautions for COVID pandemic as well. With Nipah virus emerging, take all precautions possibly, specifically with personal hygiene.